Phones now be turned silent. On behalf of the Parliament, the committee is conducting this inquiry into vaping and tobacco controls. I advise that all evidence taken by the committee is protected by parliamentary privilege. However, any comments repeated outside of this hearing may not be protected by this privilege. Witnesses will be provided with a proof version of the transcript to check, and verified transcripts, presentations and handouts will be placed on the committee's website. I welcome you, Rachel Obradovic. Have I got close? There's been some tricky ones today. Director, and Jessica Cito, Policy and Regulation Director of the Pharmacy Guild of Australia, Victorian branch. I'm going to invite you to make an opening statement or presentation of no more than 5 minutes, and then committee questions. The committee will ask you some questions. I'll hand over to you.
Thank you. The Pharmacy Guild of Australia Victoria branch welcomes the opportunity to give evidence to the Parliament of Victoria Public Accounts and Estimates Committee inquiry into vaping and tobacco control. The Guild is the national employers organisation representing and promoting the value of community pharmacy in the Australian healthcare system. For more than 90 years, the Guild has supported community pharmacy in its role of delivering quality healthcare outcomes for all Australians. Today, as we did in our submission to the inquiry, the Guild will focus on the effectiveness of current public health measures to prevent and reduce the harm of tobacco use and vaping in Victoria and potential reforms. However, since making our submission earlier this year, there have been significant changes to Commonwealth legislation restricting the sale of vapes in Australia. It is in this context that the Guild provides evidence today. The Therapeutic Goods and Other Legislation Amendment Vaping Reforms Bill of 2024 passed the Commonwealth Parliament in late June. It makes vapes available for purchase over the counter without a prescription in community pharmacy. This will be achieved by moving nicotine-containing vapes from prescription-only Schedule 4 to pharmacist-only Schedule 3 medicines from 1 October this year. This will make nicotine vapes the only unapproved product supplied as a Schedule 3. The Guild strongly opposes the Commonwealth reforms, which compromise community health, do not take into consideration the safety concerns or lack of proven efficacy of vapes as a smoking cessation device. There are several reasons why the Guild opposes the Commonwealth vaping reforms, but at the crux of this, pharmacists are healthcare professionals who dispense medication that has a proven therapeutic benefit. On the available evidence, nicotine vapes do not fall into this category. There's currently limited evidence to support the use of vaping products for smoking cessation and nicotine dependence. Vaping products have not been approved by the Therapeutic Goods Administration, and no nicotine-containing vape is listed on the Australian Register of Therapeutic Goods. There are also unknown long-term patient harms and high level of involvement from big tobacco companies. The provision of unapproved nicotine vapes without prescription legitimises a product that may be causing harm with unknown long-term health consequences. It's also uncertain whether pharmacist professional indemnity insurance covers the supply of a vaping product without prescription. Further work is required to ensure there are no legal liabilities for healthcare professionals who prescribe, compound and dispense unapproved vapes for therapeutic use where the patient has made an informed decision regarding their treatment. Furthermore, the Guild is concerned around how vaping reform legislation will be enforced, including stopping the sale of illegal vapes and protecting community pharmacies who have now been brought into the front line. We understand that enforcement is a state responsibility, however, there is detail lacking around how this will play out. As stated in our inquiry submission, the Guild advocates for the supply of smoking and vaping cessation products in the community to be regulated. The Guild supports vaping and tobacco control, complementing appropriate evidence-based smoking and vaping cessation treatments which meet the varying needs in the community. Single-use devices pose the maximum threat to being appealing to adolescents and children, and there should be no exception for these devices to be available in Australia. We acknowledge too that Australia's most accessible primary healthcare provider, community pharmacies play an important role in the prevention and reduction of the harm from tobacco use in Victoria. Pharmacists and pharmacy staff assist smoking cessation in several ways, including providing advice around quitting and advice on support on nicotine replacement therapy and other evidence-based products. Nicotine-containing vapes are indicated for smoking cessation and treatment of nicotine dependence only when other evidence-based treatments have failed. To this end, their classification as a Schedule 4 medicine available by prescription only is appropriate. The Guild's position is that only legal access to nicotine-containing vapes is through the community pharmacy on receipt of a valid prescription, following a consultation between a patient and a prescriber. However, should the reclassification of nicotine vapes as Schedule 3 medicines proceed from 1 October, the Guild believes these products should be required to be on the Australian Register of Therapeutic Goods. Guidelines must then be established for pharmacists to follow if they do conduct a patient consultation for the supply of nicotine vapes. To this end, the Guild has previously advocated to the TGA that the treatment period of nicotine vapes as a smoking cessation aid should be limited to 12 weeks, consistent with other nicotine replacement therapies. We urge the Victorian Government to support patients motivated to cease smoking or vaping through greater access to evidence-based treatments for nicotine dependence. This includes rejecting the reclassification of nicotine as Schedule 3, working with the Guild to determine what a solution that prevents vapes falling into the hands of children while respecting pharmacists' roles as healthcare professionals who dispense medication, providing a therapeutic benefit, granting pharmacists prescribing rights for smoking cessation treatments and amending clinical criteria for these listings to recognise them as treatments for the cessation of nicotine vaping, and ensuring only nicotine-containing vapes are recognised as therapeutic goods if they are included on the Australian Register of Therapeutic Goods. The Guild will always seek a solution that enables pharmacists' role as healthcare professionals delivering quality healthcare outcomes for all Australians. We look forward to working with the Victorian Government to optimise smoking cessation management based on the contemporary clinical evidence and safety protocols available for therapies. We thank you again for the opportunity to participate in today's inquiry.
Thank you so much. We'll go straight to Mrs MacArthur.
Thank you so much. You've provided a very erudite presentation of the real issue we're facing with. Was the Pharmacy Guild consulted before the federal government announced that you become tobacconists?
No.
No.
Consulted, no.
No consultation whatsoever. Well, that doesn't seem appropriate, does it?
We would agree. No, it's not appropriate.
Okay. So, what would you say is the best way to get people off this product that's, you know, so harmful?
Therapies.
Yeah, I guess there are evidence-based therapies that are used for smoking cessation that are proven on the Register of Therapeutic Goods. So you've got your nicotine replacement therapy, the traditional type, and you've also got some prescription-only medications that GPs can prescribe for smoking cessation as a pharmaceutical benefit. So I think there's more effective ways that people who, you know, are looking to cease smoking, cease vaping could be, I guess, helped by the government. So potentially in Queensland there's a smoking cessation community pharmacy pilot that enables pharmacists to do more for patients. With these reforms, you know, pharmacists won't be able to do, I guess, all of the work around helping people quit smoking. So they'd potentially have to refer patients back to the doctor if they did genuinely want to cease smoking or need management for nicotine dependence and want an evidence-based treatment. So enabling pharmacists to be able to, I guess, prescribe treatments that are already on the pharmaceutical benefits scheme would be more effective.
Can I just ask, how many pharmacists do you think will involve themselves in rolling out the selling of products over the counter?
It's a good question. It's not mandatory for pharmacists to stock these as a Schedule 3 medicine, and at the time that the announcement was made, the Pharmacy Guild, the Pharmaceutical Society of Australia and a number of the other banner groups did come out and say that they will not be stocking and selling those products as a Schedule 3 medicine.
Yeah, so clearly it'll fail, that proposal. So we heard also from the young people in the education sector here earlier that primary school age children are perhaps using vapes, and, you know, where would they get them from? Well, maybe in a household. So would you see that as a problem if you're providing vaping products over the counter to an adult, that it might be left lying around in a household for a young person to use?
I guess that's always a risk with any type of medicine, but yeah.
Pharmacists will only be able to provide under the regulation to those who are aged 18 and over, but as I think Jess has just alluded to, that is a risk with all sorts of products that are in a household.
Yeah, tell us about the insurance issue that you're going to face.
So there's a number of different issues with regards to insurance. So you've got professional indemnity insurance that pharmacists are required to have as part of their registration. It's unclear at this point whether or not pharmacists will be covered by that insurance to supply an unapproved good. So the Guild has sought legal advice on that. And then you've also, I guess, from the other perspective is premise insurance on a pharmacy. So, pharmacies could become a target for attacks if they're keeping vapes. So that's likely to increase the cost of insurance. So it's probably a deterrent for people to actually keep them, but you could still be a target without stocking them. It's going to have these impacts on both the professional and also on the pharmacy.
So this proposal that the federal government have rolled out is clearly not going to work. You're not going to supply the product, or a majority of your members are perhaps not going to supply a product. So what do you suggest? Government give it the flick and start again?
I think
We were advocating, at the time that the debate went through, we were not in the debate, as it was, our position was it's not a Schedule 3 medicine, it's not a debate that we needed to be in. As a product that was being prescribed was something that we were part of that process. I think there was a view that needed more time to see if the prescriber model was effective for an effective use. But at this point in time, there are no vapes that are have been listed for therapeutic purposes, and that's a concern for us through it to a Schedule 3 medicine.
Yeah, so unless the government could get them on the Therapeutic Goods Administration tick list, they're a problem.
That would be our position, yes.
Yeah, okay.
Thank you. Mr. Galea.
Thank you, Chair. Thank you both for joining us today.
No worries.
You've put a very good case forward, and you've also, as you've also noted, it won't be mandatory for pharmacists to dispense vapes. Just noting the very important role pharmacists play in local communities. I'll give a shout out to my pharmacist, Louisa, and the role that they play in providing that very much frontline health support for all sorts of different issues. Is there a risk that if pharmacists don't engage with this, then that people who would otherwise have that opportunity to talk with the local pharmacist to get that support they might not even realise that they needed by going to them for a vape, is there a risk that that might be missed?
I don't think so. I think that as just said earlier, and we'll go back to it, there are currently smoking cessation products available that have been approved, which I'll get Jess to talk about more, where we think that there's actually real scope for pharmacists to actually engage with patients and actually support them in quitting smoking through other proven methods.
And I think you have to recognise that people that genuinely want to quit will be inclined to come and speak to a healthcare professional. I think, there's the recreational use, and there'll still be those people wanting vapes for recreational use, but those with a genuine desire to quit will engage with their health professional.
I guess perhaps more thinking of those people that may sort of be falling into a problem without sort of realising it, thinking that they don't have a problem, by having to go and talk to their pharmacist, start that conversation. The pharmacist might say to them, well, hang on, you've been here a few times for this now, let's have a conversation about this. Is there any potential for that to actually help people out of vaping through their pharmacist?
One of the concerns with regards to your statement, they may be coming a few times, so they potentially could go to any pharmacy. There's no recording as part of the federal legislation, so pharmacists won't have oversight of how often these people are accessing vapes. So, yes, ideally, if someone is coming in, then you would have that conversation. Not to say that they won't come into a pharmacy to see if you do stock vapes, and you can still have that interaction. Yeah.
So as far as you're aware, there's, and based on what's been said to you, there's going to be no reporting mechanism like the
That's our understanding, that's right. So our understanding is that the expectation is provide, I think, Jessica, it's a month's supply, but there is no way of recording that, no way of seeing if someone's tried to get a month's supply from alternative pharmacists and therefore have got multiple of these devices.
They could become a retailer themselves. Pharmacists use every opportunity. So for any time somebody comes in for, let's say the pharmacist is selling vapes and they come in for that month's supply, isn't that the opportunity every time to then talk about other options as well as vaping? I would have thought that's a great opportunity to engage people around those, what you describe as proven
Yep.
methods, wouldn't that opportunity be better taken than not had at all?
Well, I guess from our position as an S4 medicine, they would be speaking to their doctor.
Well,
Yeah.
I mean, those times have changed.
Yeah.
But isn't this an opportunity for pharmacists to actually deliver some of that great healthcare that pharmacists provide in so many other areas?
It would be, but I guess the issue is that there's not a lot that we can then do other than have that conversation. So nicotine replacement therapy over the counter is quite expensive, so it can be quite unaffordable unless it's as a pharmaceutical benefit. Pharmacists won't be able to prescribe as a pharmaceutical benefit.
And then, so seeing your doctor, which sometimes costs maybe $80 to go see your doctor to get a script, as the old method was, that's probably a saving straight up for people then to have that conversation with pharmacists and maybe put that money towards some of those, what you describe as proven methods.
Yeah, you're looking probably a week's worth is maybe about the $35 mark, so it can get quite expensive.
So the issue there would be working with the state government around what pharmacists' role can be via scope of practice in order to come up with a model whereby, yes, we could do that, but ensure that the availability of the current existing proven products are not cost prohibitive.
So it's really actually down to a dollar thing you're saying, rather than a pharmacist being available to talk through what's in the best interest of the patient. We're not currently provided funding for this, so therefore we probably really aren't going to be able to, and would prefer that in a different place.
No, I don't think it just comes down to cost. I think they're not proven therapies, so pharmacists.
But you're happy to, at a Schedule 4 level, to say that they are proven enough for
At
a
a Schedule
doctor.
4 level, it's on a prescription basis where they've had a conversation with their GP, and the idea of a Schedule 4 on a prescription basis is that it is a last resort. It is to a point where other methods have been tried and have not prevailed and have not worked. And we're at this point now, whereas shifting it from that to a Schedule 3 medicine shifts that conversation away to it simply being prescribed as an over-the-counter medication. Yes, the conversation can still be there, but the ability for a pharmacist to, under the current model, to have the ability to really work through what the other treatment methods might be before we get to an unproven product would need a referral back to a GP in order for them to receive them with the pharmaceutical benefit scheme.
Can I just butt in here? Have pharmacists got the time and the ability to provide, medical advice to a potential patient you don't know anything about their other history?
It is an area. Pharmacists' role in the community is to provide this sort of advice to patients on proven medications with a therapeutic good. It is what they see their role as doing. It is very hard with this one where there is no evidence that these devices do work for the purpose of smoking cessation.
Right.
And that, I think, is the challenge there. So I wouldn't want to go as far as saying, no, they don't have the time. They are small business owners. They are very time poor, but they do look after, particularly in rural and regional Victoria, they do look after their patients. They are on the front line of the provision of, community health care. So to outright say, no, they don't have the time to have these conversations.
Or the ability.
But it is more that these goods are not proven to actually achieve the purpose that we're wanting to see here, which is the smoking cessation tool.
And it is quite a lengthy consultation that pharmacists are being asked to undertake as part of this Schedule 3. So essentially doing the work of the GP, but in the pharmacy. Yeah.
Okay, Michael, I think you had one last question.
Oh no, it's fine. In a lot of time, I'll yield the rest. Thank you.
Okay, Mr. Poyelli.
Thank you, Chair, and thanks for coming. I might just pick up sort of where we left off, so the idea of doing the work of a GP. The previous federal proposal, prior to the amendment that saw it go through the chamber, where it was a prescription model for accessing these products, who is it at the end who dispenses that product?
So up until now, there's been two different pathways. So either through community pharmacy or the personal importation scheme. And for the majority of people, they've been using the personal importation scheme. So,
Sure. But for some, there will be, at the end, even if that model had been implemented, a pharmacist dispensing that product to the consumer.
yes.
Okay. So I suppose, given that, and given where we've landed, where it's Schedule 3, I mean, really, in terms of the role of the pharmacist in that picture, what's changed?
So this is the only unapproved good that is supplied as a Schedule 3 medicine. There's lots of pathways for unapproved products to come into the country, but they follow, I guess, defined pathways through the Therapeutic Goods Administration. So that is what has changed. So that whole landscape of supplying an unapproved product as a Schedule 3 medicine without a prescription, it's the only medicine supplied as an unapproved Schedule 3.
Okay.
So what that means is that it's not registered on the the Therapeutic Goods Association have not listed any of these products to be registered on the Therapeutic Goods Administration, the Australian Register of Therapeutic Goods. Apologies for...
Yeah, no, I appreciate
which means that there's nothing proven that it is a medical device. There's no efficacy,
Right.
there's no been research, there's no efficacy around it, whereas other Schedule 3 medications do have that. They
Okay.
do have those approvals. That's the difference.
Okay.
So you're asking pharmacists to effectively provide a product
Yeah.
that has not gone through the processes to say that there is a therapeutic benefit here, whereas all the other Schedule 3 medicines have.
Okay, just to make sure I've understood correctly though, so the previous proposal, where it was a prescription medication from a GP, were you approving of that model?
We did support the Schedule 4. We thought that that was appropriate for it to be on prescription like other unapproved goods, and with consultation with a GP who can then offer a
Yeah.
broader range of treatments that have evidence behind them.
Right, see, this is the thing I'm just trying to get my head around. So you're supportive of it if it were a Schedule 4 from a GP, even though it's not listed on the TGA, but that's an issue when it's Schedule 3.
Correct.
Yes.
Can you clarify that a bit more for me? That doesn't quite make sense.
Just
I guess-
the understanding that it would not be the only Schedule 4 medication.
It's the only Schedule 3 that's unapproved, so...
It's not the only Schedule 4, is that right?
No, that's right, yeah. There's other Schedule 4 medicines that are unapproved, and as I said, follow the defined pathways through the TGA.
Yeah.
But I guess one of the issues is that pharmacies can't then provide other treatment options for patients. So, the GP writing on a prescription could say, there's better evidence base for this prescription medicine, I'll supply you with that instead. So I think it's about, the patient getting holistic care.
Right. It just feels a little bit arbitrary that the TGA consideration isn't a concern if it was Schedule 4, but it is for Schedule 3, when at the end it may be the pharmacist dispensing anyway. That just, yeah. I appreciate your going into detail trying to clarify though. The other nicotine cessation products that you do stock that I believe, just correct me if I'm wrong, is Schedule 2? Is that how you classify it?
They're actually unscheduled.
Unscheduled, okay. So those aren't listed by the TGA, or they are?
They are. They're on the Australian Register of Therapeutic Goods.
Oh, okay.
Yeah, yep.
All of them?
Yes.
Yep.
Okay, no, good to know.
They are, yeah.
And just clarifying as well, in terms of access to the product, even in the current form that has passed through the Parliament, those under the age of 18 are still accessing it via prescription from a GP. So you may still be in the scenario of dispensing to someone underage. Just to, so we've made sure we paint the picture properly of instances where you might be dispensing these products.
So that's the federal legislation. There's state and territory legislation that potentially contradicts that in terms of the Tobacco Act as to whether or not a patient under the age of 18 can be dispensed a vaping product on a prescription. So we're currently trying to understand those complications as well.
Yeah, could you talk about that in a bit more detail? What's the conflicting issue?
So there's the tobacco legislation and the therapeutic goods legislation, and they don't marry up at this point. So in some states and territories, you're actually prohibited from supplying a vaping good to a patient under the age of 18 with a prescription. So even if a doctor writes a prescription, there could be other legislation that prohibits the pharmacist from actually dispensing it.
Right, so would you say there might be need for Victorian legislative change to actually implement the federal policy that's just come through?
Potentially.
Potentially, yes.
Okay, that's really valuable, thank you. I might just leave it there. Thank you,
Great,
Chair.
thanks, Mr. Puglielli. Mr. Tack.
Oh, thank you, Chair. Just one question from me. Do you believe that the general population has adequate access to understanding the impact of harm from vaping e-cigarette? If not, what more can be done to increase awareness and promote behavior change?
Yeah.
There hasn't been a lot of public health campaigns on vaping. Obviously, in more recent times, maybe government's putting more resources into it, but I think probably more funding needs to go into research to actually understand the long-term harms. I think, potentially having them as a therapeutic product is legitimising a product that we don't know what the long-term consequences are.
And that's one of our concerns that we stated earlier, is it is potentially legitimising quite a harmful, dangerous product.
But just, sorry, to just follow on from before, if it was on Schedule 4 though, that wouldn't have been an issue.
Again, with the Schedule 4 medication, the expectation is with it being prescribed by a GP, that it is a last resort, and that the GP has had the opportunity and their patients have had the opportunity to use other nicotine replacement therapies that are available, that are evidence-based, before this has got to a point where it's even prescribed.
Right, thank you. Sorry to jump in.
Yeah, okay. Thank you, Chair.
Mr. Hilakari.
Just a final one. I know you've mentioned previously that there's an opposition to this. I'm just wondering the percentage of pharmacists who actually are currently, that you're aware of, or intend to, or have indicated to the Guild that they intend to supply vapes.
I'd have
Or
to
not-
take it
or
on,
it's all-
take
it's
it on
all too
notice.
early.
No,
It could be all too
I'd actually
early.
have to take that one on notice,
Yeah.
because it's such
It's so
they are
early.
small business owners. What has come forward is the big banner, the larger banner groups that have said that they won't.
Yes.
But understanding the individuals,
Yeah.
independents that might,
Yep.
we'd have to take that on notice and see what
And I
has come
understand it's
through.
totally
to us.
early days.
Yeah, it is
and
early. It's
a very
early.
changing situation.
And look, for context, the groups that have come forward and indicated that they won't be providing them are groups such as 777 Pharmacy, Blooms have come forward.
Terry White Chem Mart,
Terry White Chem Mart,
Priceline.
Priceline. So we're talking a large number
Yeah.
have said no.
Yes.
But in terms of any of the more independent, smaller ones,
Yeah.
we would have to take
And
it on.
on notice this time. Thank you so much.
Yeah,
Really
no
appreciate
worries.
it.
That's okay.
Thank you, Mr. Hilakari. Well, that brings our time together this afternoon to an end. Thank you so much for taking the time to come and talk to us.
Thank you.
The committee will follow up on any additional questions or questions taken on notice in writing, and responses are required within 5 working days of the committee's request. The committee is going to take a very short break before recommencing the hearing. I declare this hearing adjourned.